This is the Getting Ready to Test, a review preparation manual for drug and alcohol credentialing examinations. This will be the introduction. It is the 8th edition, which is the latest edition as of today. And I will just be reading the introduction as well as breaking down how the book is laid out. The road to becoming a drug and alcohol counselor takes a great deal of hard work and effort. At the present time, there is no single unified credentialing process. Each state in the U.S. has options that include licensure, state mandated credentials, and or certification, a credential offered by private body. Many countries around the world do not even have organized credentialing bodies. Some credentials require college degrees, some only require a certain number of educational and experiential hours to be obtained. Most, regardless of the credentialing, require some sort of written and or oral examination before granting the credential. Currently, most states typically use one of the two available national credentialing exams, one offered by the International Certification and Reciprocity Consortium, Alcohol or Other Drug Abuse, i.e. ICNRC/AODA, and one of the National Association of Alcohol and Drug Counselors, which is the NAADAC. In Texas, we use the ICNRC. One other credentialing is offered by the American Academy of Health Care Providers, though it is not recognized by many states at this present time. The process used is very similar with both tests. Both use a written multiple choice examination, and some ICR and RCAODA member boards also require passing a 12-question oral examination. In the state of Texas, we do not need to do an oral examination. NAADAC written exam is about 250 questions in length, and it is 150 questions long. So the one that we take in Texas is going to be the 150 question long. These written exam test a candidate's knowledge on a variety of topics that have been determined to be the base knowledge required for drug and alcohol counselors. NAADAC uses the following categories for their information: pharmacology and psychoactive substances, counseling practice, theoretical basis, and professional issues. ICNRC AODA uses these four domains of information. Domain 1, screening, assessment, and engagement. Domain 2, treatment planning, collaboration, and referral. Domain 3, counseling, and Domain 4, professional and ethical responsibilities. See Section 4 for more information on American Academy testing process. Both basically require a 70% passing rate. They are both scaled by test pool, so the actual cut score may be slightly higher or lower than 70%, and depending on the state, there may be limits to the number of times a candidate may sit in for the examination. Regardless if the candidate is unsuccessful in passing the exam, to take the test again requires an additional dollar spent, typically $150 or more for each time a candidate must take the written exam, as well as the added stress and pressure to succeed. In the state of Texas, the national exam, the state exam is actually around $275. That is the process of this manual, is to help the candidates review the basic need to know information that is typically required for one's knowledge base, as well as the experience what it is like to take a lengthy multiple choice examination. Since this field that is individuals since this is a field that individuals typically will enter later on in life, most candidates are adult learners. As a result, most have not taken an exam in this magnitude for many years. Test taking anxiety alone may account for the difference between being successful or not. This manual is not intended to provide an in-depth knowledge for that which will be required to be a successful counselor. Rather, it is intended to provide a quick review of the more important facts, basically the need to know information. Plus, it will allow you the opportunity of sitting down and taking a sample examination, scoring the results, and judging your likelihood of success. It can also help pinpoint major areas and weaknesses that may exist, allowing more in depth review and studying prior to spending money and time and effort and taking the actual credentialing examination. The manual is comprised of 4 sections. The first section deals with information that is drug and alcohol specific. It looks at the field in general, reviews the accepted theories of addiction, and looks at specific drug and alcohol knowledge and explains treatment approaches commonly used in the field. The second section deals with the core functions of counseling. This section is largely presented as an outline format, reviewing such things as screening, assessment, intake, orientation, counseling, individual, group, and family, and other topics. The materials at the section were originally developed for the project of addiction counseling testing, training, and CSAT program in the early 1990s. That was intended for training the minority of counselors and assist them in entering the drug and alcohol field. The information, therefore, has been tested and used successfully by a variety of individuals across the nation. The third section deals with the more specialized areas of training. That is psychological theories of change, ethics, HIV and AIDS, co-occurring disorders, cultural information, and specific special populations. While not an all-inclusive set of specialized knowledge, it does represent a major portion of the knowledge base that will be included in the testing process. The fourth and final section contains information about preparing and taking an examination of this length. It also contains 150 sample examinations, and the examination is comprised of questions that are similar in structure to what both NAADAC and ICRC/AODA uses. It does not contain questions from any past examination. Rather, it is intended to give a candidate the feel. For what it is like to sit in for an uninterrupted period of time to take such an exam, and to provide an opportunity of testing one's knowledge and to see if there's any gaps or areas of need.